Okay, you're gonna have the patient lay prone on a table with the ankle hanging off the table in neutral. And then you're gonna take your goniometer and put the stationary arm, and the axis is on their Achilles. The stationary arm is on the midline of the posterior part of the leg. And the movable arm is just gonna be hanging off their foot. So, evert, can you evert? You're just gonna glide goniometer, and that's 5 degrees, so she is in normal range. And then can you go back to neutral? And then can you invert? And she is approximately 20 degrees, so she is below average. We are going to be measuring the passive abduction of the first MTP joint. The patient position should be supine with the ankle in neutral. You place the axis of the goniometer over the distal aspect of the MTP joint, right here. And then the center of the stationary arm should be over the first metatarsal. And then the center of the movement arm should be proximal over the phalanges. And then you're just going to passively abduct their first metatarsal. And that is around 15 degrees. We are going to be doing a flexion extension of the great toe. The patient position, it should be supine with ankle in neutral. Center of stationary arm on the midline of the MTP joint, and center of movement arm of the midline of the proximal phalanx. So for flexion, position the axis of the goniometer over the dorsal aspect of the MTP joint being tested. So you put it over the joint right here. And then you're going to have the patient flex their big toe. And that is around 50 degrees. And that is above average, or 30 degrees. And then for extension, place the goniometer on a plantar surface to test the MTP extension. So you're going to find the joint line, place the goniometer right here, and then you're going to have them extend their great toe. And that is around 80. And that is above average of 70.